How both of you?
Thanks for having us today.
Yes, I understand we're going to be talking about robotic treatment for patients with spinal cord injuries, something that has been used in Japan and Germany and more recently approved by the FDA for use in the United States.
Mm-hmm.
Is that correct?
That is correct.
All right. So why don't you tell me, Dr. Tonuzi, about this new process, trying to HAL, hybrid assistive limb.
Sure, I'd love to. So medical HAL, or hybrid assisted limb, as you just mentioned, is the world's first advanced robotic technology that has been already shown to improve the ability to walk in persons with spinal cord injury. It's a robot exoskeleton device. It basically wraps around a person's trunk and lower extremities and has a sensor signal that is placed on the lower extremities that is able to basically perceive signals that are sent from the brain to the spinal cord to the legs. So it's really unique in that it's able to operate from a person's own volition, detect their signals, and turn that into mobility, the ability to walk, and hopefully the idea is the ability to walk without the use of the device.
I see. And how long has it been used in the United States?
Well, we just got this technology. So it's actually been available, I think, as you mentioned, in Japan for many years. Next, it made its way over to Germany. And we've been aware of the technology for over 3 years now and have been working really hard with Cyberdyne to get the technology over to the United States. It finally was FDA cleared, as you mentioned, back in December. And we are just up and going with Maverick, and we've got one other person right now that have started to use the device. But today is kind of our grand opening at our Brooks Cybernic Treatment Center. So from this point forward, we're really looking forward to having this device available for those with spinal cord injury who would be excited to use it here in the United States.
Okay, so this is sort of the launch.
Absolutely. We're getting things started. Maverick has used the device for about 14 sessions or so now, and he's got quite a few more to go, but it's one of those things we use it every day, 5 days a week, and usually it's about 60 sessions to really get you where you want to be. That's what's been tried and proven in other countries, and we're doing our own research here as well, but just getting the ball rolling with our first 2 participants right now.
And Maverick, tell me what your experience has been with it.
My experience so far has been very positive. We've already on the 14th session, something like that, and we've seen results trending in a positive direction. And hopefully it'll get me to my main goal at the end, which will be walking independently one day.
Very good, very good. And can you tell me what I guess I really want to know how it works for you. How does it work for you?
Right, and I've used other exoskeletons before, and all those have preset step lengths and everything like that, and with HAL, it's picking up my signals. So when I want to move my leg, I can move it. I'm controlling my steps.
I see. And when you have your experience with it, how long do you use it?
It's an hour each session in the suit.
Okay, you use it for an hour each session. And how many sessions do you do a week?
5.
How many?
5.
5?
Yes, ma'am.
Okay, all right. And you had spinal cord injury originally?
Yes, ma'am.
And what caused that?
It was from an ATV accident.
I see. Okay. And you were at the Brooks spinal cord injury program.
Yes, ma'am.
All right. And where are you located?
Jacksonville, Florida.
In Jacksonville, Florida. Okay. And where can people get more information? I can ask both of you that, Dr. Tonuzi and Maverick. Where can people get more information about this?
Well, if they want to go online, we would definitely encourage them to go to our website. It's www.brookscyberdyne.org. I would just definitely.
Hold on.
I'm sorry. Yes.
www.
Brookscyberdyne.org.
Brooks
Cyberdyne.
Brooks what?
Sorry, Brooks Cyberdyne.
Spell that for me.
Sure, it's CYBER, Cyber DYNE.
Okay, all right, I have it. And they can get more information there?
Absolutely, there's quite a bit of information on that website.
Okay, that's good to know. All right, well, I certainly want to thank both of you for sharing this information with my Health Power audience. I'm sure it will be helpful for them. I'm delighted that you're having your launch, and wish you well as you continue, Maverick, with your treatments, and Dr. Tonuzi as you continue with your work.
Thank you so much. We appreciate it.
Okay. Have a good day, both of you.
You too.